Hello, my name is Dr. Douglas Sadownik, and thank you for coming to my YouTube station. I'm a therapist and a professor with 30 years experience, an award-winning author of 2 books, a performance artist. I founded the nation's first LGBT Specialization in clinical psychology at Antioch University in 2006 and Colors LGBTQ Youth Counseling Center in 2011 with clients as a Bronx boy who grew up to be gay with lower middle class Jewish Depression era parents back in the day. The door is opening because the cat has just walked in that room. Can't see him. So please smash the like button and subscribe to get more exciting videos like this. Just so you know, the next video we're going to see, this is a Process 1 class at Antioch University that I taught recently, just a few months ago. This is around December 21st, solstice 2023. The students are amazing. I can't tell you how cool these students were, graduate students in clinical psychology. They were, granted, a bit tired, and they didn't want to do their role plays, and it was raining outside, and I was frankly kind of tired too. And these great students, you know, they said, hey, Dr. Doug, they put me on the spot. They said, would you please do a mock client show and tell for us, because we really want to see how you work and like that. And I was like, wow, this is 10 o'clock in the morning, and we only got like 20 minutes, and okay, what the heck. And the student, great student, Max, he volunteered, and he's so amazing. And just so you know, the material Max is going to be talking about as a student therapist is completely fictional. It's all made up, so anything he's saying about his partner, it's not real. His partner is cool. They don't have any real problems like this, so it's all fictional. Please keep that in mind. This is a class mock. So, hey, I was going to teach the class about how to do 3 different types of therapies in 20 minutes. Existential Humanistic, which is the baseline of what we were trying to do in class. Cognitive behavioral therapy, which is what most of the clinics are actually asking the clients to do, and about goals and structure. And psychodynamic, which comes, of course, from Freud and his followers in object relations and self-psychology, about issues related to the past and working in the field between the client and the therapist in terms of what comes up. So this class is about how to do therapy, but of course it's really how to listen. We could have spent the whole class just on existential humanism, the humanistic approach, advanced by Carl Rogers. I mean, he's so cool. He's coming at the whole situation from unconditional positive regard for the client, and at the same time how to be congruent with one's own feelings, thoughts, which is very difficult. It almost sounds like a contradiction, but the therapist is real most of all with themselves so that they can digest and metabolize those feelings to the client. We don't want to be giving advice to clients in the existential humanistic model. We don't want a lot of silence to go by. That's way too passive. We don't want to be obtrusive. We want to develop this kind of listening that expands the field of openness and feeling and thought. And easier said than done. This is also great for couples counseling. Essentially, you're basically listening to the client's meanings and thoughts and reflecting them back in a way that makes it feel as if it's real. You're not like a kind of parrot. You're summarizing, you're collating, you're making sure you're getting everything right, you're getting the story down. You might ask for some clarifications, especially if the client is speaking in euphemisms about big terms like love or you know or it. You can ask for clarification. Sometimes you want to help flesh out the story a little bit more so you get the, the cinema of the situation without being too invasive. And that allows the client free rein to open up and to be received and to receive you. But I also want to teach the students in class how to be prepared for their clinics, which are going to be probably more inclined to have the session be more focused around goals. A lot of clients want more than to be seen and heard. They also want to have a goal focused on. Many clients have a very sometimes ambivalent or ambiguous way of holding the goals that they want to get across to the therapist. The therapist is listening carefully to help clarify what the goal of the treatment is. And you can see a little bit how I accomplished this with Max. I didn't go overboard. We only had about 15-20 minutes, but I was, I think, pretty good about trying to help him just maybe get to 1 or 2 goals. Oh, here's the cat. You can't see the cat. Sometimes you get the feeling, let's see, she won't let me pick her up, that the client wants also more. They want to go more into the soul. They want to go more into the unconscious. They want to go more into some of their internal contradictions and even neuroticisms and violence. That's where you bring in the psychodynamic school of thought. That's a whole series of YouTube videos. I need to do more of those. But in the psychodynamic, we're getting at the level that there are these complexities that are underneath in the unconscious. Person may or may not be aware of them, because a lot of those complexities are developed in early childhood. Some of them are infantile. They are going to come up. They're going to get projected onto our partners. They're certainly going to get projected onto the therapist. Ideally, a therapist works with them in a very cool way. I delved a little bit into psychodynamic, you'll see, with Max, just enough to get him to see he was projecting his parents onto his partner. Oh, there's so much more I want to share with you. This is a short mock video presentation. It's great for all of those out there who want to learn more about therapy, students of therapy, therapists, supervisors. It'd be so maybe grandiose to say it could help a lot of different kinds of people. It's very brief. I've been doing this for 30 years. I've been teaching for 30 years. And you see it also has a kind of a little bit of my eccentricities, of course, are always going to come in, but hopefully objective and grounded enough that the client feels the intentionality is always on their behalf. I'd love it if you could support this channel. Please smash that like button, hit the subscribe. I'm so excited to share this knowledge with you. Like I said, I'm a child of the Bronx. I'm also a child of the streets and of performance and of art. I wrote 2 books. I'm writing a 3rd right now, but I've also moved my life into becoming more of a healer, more of a therapist, a professional psychologist. So bringing all that together here in these YouTubes, I can't wait to share more with you. Please feel supported by my work, and please also feel free to support it. Thank you so much for coming. Really appreciate you. Max, it's great to see you. I think this is our 3rd session.
Yeah.
And we did a lot of stuff, I think, already on your relationship. Mm-hmm. And I know you came in originally being pretty down.
Yeah.
How's it going today?
I wish I could say it was going better. Mm-hmm. It's just, I keep bumping into this thing with my partner where they just seem to have these big reactions, and it gets so volatile. I feel like I'm walking on eggshells. Like
you mean like what we talked about? I think last week you were saying something about it being really used volatile. Mm-hmm. I think you told me what you meant by volatile.
Yeah, like sort of reactive and like testy, very easily swayed by their emotions.
By their emotions. Yeah. Wow. And it sounds like it's just the same as it was last week, but maybe not even a little worse. Is that correct?
Yeah, I'd say maybe a little worse.
Wow.
Yeah, and it's just I don't know. I feel like I'm the sort of person that really, is able to kind of sit with big feelings when they come up. Like
I noticed that.
Yeah, and like I don't know. I feel like I want to be with someone who is a calming presence, who can really just like sit and like hear me and understand me, like kind of the way you make me feel in these sessions. Like how you just like, I feel like you see me, and I need to be with someone who sees me, who's like sees who I am and can just like.
Well, that's so. Yeah. I heard a lot of what you just said there. First of all, when everyone says in therapy, I need to be with somebody who sees me, that's always really listen carefully to that. And that's so beautiful that you could make that intention. I'm concerned about your relationship with this person. I want to know a little bit more about it too, by the way, because we're just touching on it a little more general. But then I also got the feeling that you feel really good with me and you feel safe. And I just think that that's great. You know, I think you were mentioning, if I'm not mistaken, that you were looking for a queer affirmative therapist. Am I correct about that? So that is that an important part of you think what's going on here?
Yeah, I mean, you know, my partner's queer as well. They're non-binary, and you know, I think it is, you know, it is a bit of a different dynamic. I've had therapists in the past who haven't necessarily been comfortable understanding some of the differences in how those relationships work. And I feel like you really get that. Yeah.
Oh, that's really great. I'm so glad you feel safe with me. I'm hoping that those good feelings that you're experiencing, we can maybe put them in safekeeping when maybe there's something that comes up that we need to work on a little bit more. So, but I really, I think it's very helpful that we both feel good here, you know, and can affirm that. Let's help me understand a little bit better what is going on at home, because I don't think you mentioned to me last week you're interested in leaving, and maybe we could use a little bit of a goal even about how to work with this person, right? If you feel comfortable with that.
Yeah. In broad strokes, you know, it's just we keep bumping up into these conflicts where I feel like they're very critical of me and of like I have a tendency to sometimes get like a little irritable, stressed out with work and school and things like that, and it always seems like they get very shaken up by that, even when it's not directed at them. And sort of like
Max, could you give me an example of like what was either the more recent one or what was the more intense one, so I get the picture of it?
Yeah, so like a recent example was, you know, we were sitting down together at breakfast, and I made some, you know, comment about something in the news that I had been reading, and they kind of snapped at me. They're like, well, you know, you shouldn't be so quick to judge. And it just seemed like it was like I wasn't being judgmental in that moment, and they just kind of assumed that was where I was coming from. And
see, what happened for you in that moment? Is it okay if I kind of inquire a little bit? I want to sort of get it inside with you a little bit, and I know that because we both feel trusting with each other, maybe we can go there. If you could slow down, what actually happened internally to you when this person snapped?
I feel like I go into defense mode.
Oh, say a little bit more about that.
Like I bristle a little bit. Yeah. I'm ready to I guess it's that fight or flight. Like, yes. I'm ready to lash back out and say that's not what I was saying, or
brilliant. Yeah. Is that often what happens? Is then you might lash out?
Yeah, I mean, you know, not like physically or not. I don't shout or anything, but I will. Right. I will feel the need to defend myself.
I see. Yeah. Did that happen this time around the comment with the politics or what it was?
Yeah, a little bit. I had sort of said I'm not being defensive, or I'm not being judgmental here. I was just sort of making a comment.
I understand so much more what's going on. I'm gonna move into a little bit of maybe, if you want me to, a little bit of a way of managing that a little differently, which would be kind of like a slightly different approach or behavior. Are you interested in that? Because I think if I remember looking at the intake notes, you were looking for tools to improve your relationship with this person. You care about this person.
Yeah, I do.
That's cool. That's great. So maybe it's lovely to feel as if I see you, and of course that's my job. But maybe there's some also really great learning here to figure out how to work with this person. Because I wonder if this is going to come with you and me too sometime. If at that moment when you feel attacked, is something happening at that moment, right? Where you're feeling something because the person was snappy.
Yeah.
Maybe it's enough to imagine that you're having an emotion, whatever it is. Because isn't that what defensive means? Defensive means I'm having an emotion.
Yeah, and I guess, maybe the emotion would be anger at being accused of something that I'm not not doing.
That was fantastic. You just named precisely what could be the feeling, anger at not being perceived. Precisely?
Yeah.
So when you're feeling angry at not being perceived properly by somebody who you care about, you get angry, you might get some other feelings in there too.
Yeah. I mean, there's like a frustration and maybe even like a despair. Like in these moments, I sort of, my brain immediately goes to like I can't be myself around this person, and I should just give up. I should walk out because there's no, like, clearly we're different people and they're not going to understand me, and I'm never going to be seen here. So I just need to, find someone else.
I think you're demonstrating what all of us go through at the moment when we get defensive, because our parents probably didn't teach us, but I'm going to maybe see if we can repair that, how to work with what happens when we get defensive. So then the mind takes over, and then it's like it's hopeless. Might as well just leave. But I think that there's a lot of other areas to go. Now, indulge me one quick sec, because if we have more time, we would do. Indulge me one quick sec. I don't know too much about how difficulties were handled when you were a little kid. Is there something that might help us shed some light on, let's say you were a little kid and somebody was maybe more judgmental than they should have been? Is there something that comes into your memory about that?
Yeah, I mean, definitely so. I feel like my mom was very critical in that way, and like it was hard to know what was going to set her off, and then if when I would say certain things, I felt like she would get very worried about me, and that worry would be like completely unfounded or out of proportion of like what I was actually experiencing, and then it would turn into this whole thing.
I really want to let you know, just like as your therapist, that we're really like working together really well. You're going with me, I'm going with you. We're like investigating what's going on here. We're moving away from demonizing your partner. We're using the good feelings you have here to work really well together. So what you told me is really helpful, which is we can begin to identify that you, like all the rest of us, grew up sometimes in conditions that were non-conducive to feeling seen and loved, right? So we're gonna do a little bit more work there and see who that little kid is in that story, but maybe part of the issue here is that little kid never got a chance to be loved and cared for in a relationship, you know what I'm saying? So he's gonna feel unsafe with this person when he's hurting your feelings.
Yeah. I mean, there were times when I felt loved and seen. Certainly, it wasn't all the time.
Of course. Yeah. Well, yeah, we're just really focusing on where these reactions may be coming from. But I can tell that you also had I could just feel that you had some experiences that were very loving and caring.
Yeah. It's just those moments when something would get triggered that it felt like all of a sudden I was dealing with a different person.
Right.
Yeah.
I wonder if it wouldn't be helpful to help you develop an internal sense of your experiences when you're with your partner.
Mm-hmm.
So, like what we did here. So, for example, your partner is inappropriate with you, but maybe through our work you can see, okay, we don't yet know how to get that person to relate to you in a more appropriate way, but I promise you we will go there, because that's not cool. But maybe for the time being, I can help you to not react so much, because it could be understood that there's a little child in there who needs to be, even if it's a few seconds, just to spend some time with the reactions you're having. That little kid's feeling put on, blah, 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 blah.
Yeah, because it seems like it's sort of, whoever starts with the reactivity, it just kind of like amplifies, and we feed off each other, and all of a sudden we're having a fight over nothing.
Okay, well, you just like solved not only your personal problems, but the world's problems. In a way, one could say that that's really why the world is in such a messed up. So look, we're gonna have to get ready to end, but I just really think, I can't believe how much work we did in like 15 minutes. And I hope that we can, I can still be there for you in the way that you need, and if there's any change in that, you please, feel free to let me know. I'll do my best to also be on the lookout for that, but what I would like to give you is some homework for next week, which is when you're with your partner and they are doing their thing, see if you can just once, instead of reacting and getting yourself in that spiral to which you just referred, pull back and see if you can get a picture of that little kid with your mother, and you're trying to be there for him rather than him to reenact the trauma. Just take a moment, just breathe, wiggle your fingers, wiggle your toes, see if you can stay in your own personhood and not get pulled into the cycle of, I don't want to call it violence, but the cycle with you. And write it down. You can even email it me, but bring it to the next session and see how we do.
So I'm gonna when something comes up with my partner, I'm gonna try and stay connected and take a beat and visualize myself as a child. That's the idea. Okay.
And visualize, and in fact, I would not respond to your partner in any way, shape, or form until you have gotten grounded. And then we'll talk about things you can eventually say to your partner.
Yeah.
Does that sound okay?
Yeah.
Okay. Thank you for doing fast and dirty therapy with you in 15
Yeah, sure.
minutes. And I'll see you next time. Good work.
Thank you.